All right. Can you see the slides?
Yes.
Awesome.
Shall we get started, or would you like to wait a few minutes for everyone? Okay.
Yes.
So as you know, Dr. Ali talks about a lot of different topics each month, and this webinar is specifically about chronic fatigue. And we want to share a quote: "Healing does not mean that the damage never existed. It means the damage no longer is a part of our lives. It doesn't control our lives." So the last webinar last month was about losing weight, and you can check out the other webinars on the holistichealing.org. You can subscribe to the YouTube channel as well as other social handles for more information. And we're going to keep everyone on mute until the end of the webinar. So if you do have questions, please type them in the Q&A section at the bottom of your screen, and we'll try to answer as many of those questions as relevant to today's topic. So today is called Cracking the Fatigue Code, and Dr. Ali is the owner and doctor running the functional holistic healing, and she is a board certified internal MD. She has multiple certifications also in holistic healing, American Board of Integrative Medicine, the College of Physicians, the Institute of Functional Medicine, and many certifications as well as nutrition, mind, body, Ayurveda, and Chinese medicine. She's been practicing for 18 years, and she's a tremendous human being that really takes the time to hear and listen to her patients to try to get to the root cause of the issues that they're experiencing.
Thank you so much, Christine. I really appreciate that intro. And I think now, since this is the first time you guys are seeing Christine with us, and we are very happy and we're very grateful that she actually came on board. And the reason why Christine is here is because she is somebody who has a very inspiring story, which is very relevant to our topic today. I'm honestly very honored to be part of her healing journey. And I think that one of the reasons why I felt that her journey is something that we all need to hear about is because this journey has many unique aspects, but there are also a lot of aspects that a lot of us can relate to. And there's a lot we can learn from. So with that, I want to go ahead and introduce Christine. She has about 30 years of experience in marketing and retail merchandising. She's a mother of 2 young adults, and I'm especially fond of her daughter. And she's very passionate about functional medicine due to her own healing journey, but also because her mom had some physical and cognitive issues. She is one of those people that you'll find extremely well-read. There are few people who actually have the degree of knowledge that she has pertaining to functional medicine. She has been generous enough to kind of share her story with us. So we are really grateful for that. She's actually a survivor. She is a fighter. And you will see that from her journey. She has overcome chronic fatigue, adrenal fatigue, non-alcoholic fatty liver disease. So she is somebody like, we can all learn from. So with that, I want to go ahead and give Christine a chance to share her story with us.
Thank you. I really was on a 15-year health discovery. I didn't realize how run down I was until I couldn't get off the couch, literally. I was working, a pretty demanding job. I was traveling quite a bit. Both my parents were ill. So yes, I did have stress in my life, but this was such a heavy exhaustion that no matter how much I slept day or night, I was not feeling capable of just existing. And it got to a breaking point. If you look at the next slide, I had been to multiple doctors, specialists, endocrinologists, and even a rheumatologist to see if I had Lyme or fibromyalgia, which I was told that I didn't. but I started reading, as Dr. Ali said, and I was wondering about adrenal fatigue or chronic fatigue, and they both told me that there was no such thing. And also I did have hypothyroid after the birth of my second child, but they said, you know, all my numbers were great and, you know, kind of just keep taking the Synthroid. But I knew that something just was not right. I felt horrible. So I started reading, and I had 8 out of 9 of the symptoms, or the identifiers of chronic fatigue. The brain fog was unbearable. I couldn't concentrate or focus. I had constant aches all over my body. I did have chronic constipation where I wouldn't go to the bathroom for 3 or 4 days. And I said, you know, this doesn't seem normal. And they said, well, everybody's different. And I said, yeah, but if you're eating 2 to 3 times a day, you should be eliminating at least once a day. And I knew that that wasn't normal. And also I had gallstones, and that was kind of an identifier for me that there was something going on. They took out my gallbladder and never really looked at why it was happening. And looking back now, I know that it was due to my liver not functioning well. And also I had irritable bowel, because by the time I got to Dr. Ali, I had chronic diarrhea and couldn't even hold my bowels. And the one thing I wanted to share with everybody is the doctors, the traditional doctors, made me feel like I was going crazy or, you know, a hypochondriac. And I knew that, you know, this was not normal. And so when Dr. Ali started doing all of the testing, I knew that the results of those tests would show, you know, where we needed to focus in terms of pieces of the puzzle and identifying the root cause of what was going on. So I did have some genetic markers as well that really, you know, may not be everybody's situation, because everybody's situation is different. Every case is individual. So if you go to the next slide, it really showed that I didn't have food sensitivities, which a lot of people do. Unfortunately, I didn't. So that wasn't something that we had to deal with, but it showed that I had several vitamin deficiencies. Cortisol was unbalanced, adrenal fatigue. I had the genetic markers for MTHFR, which contributes to depression, amongst other things. I had the non-alcoholic fatty liver, which is, you know, kind of along the lines of inflammation. There were a lot of things going on in my multiple systems. I had toxic environmental toxins, as well as high mercury, which you know, I was exposed to some things that were in a public water system contamination. And at the same time, I was going through menopause, which, you know, seemed mild comparatively to all these other things. But through that, I found out that I also, I knew that I had genetic markers for hemochromatosis, but now after menopause, my body was starting to store iron, and which is ferritin, in the blood, and that was contributing to a whole nother set of factors. So the first thing that Dr. Ali shared with me, because I wasn't sleeping, I was up late, and even if I did sleep, I was not rested, was the sleep CDs, which kind of program your mind into more of a routine, and you get deep sleep, you fall asleep faster. And I still use some of those suggestions now today, and I sleep very well. I went through multiple different testing, and I knew that my vitamin D and my vitamin K, which I never even knew vitamin K is essential for how you absorb the vitamin D. So I was even lower on the vitamin K than the D. So I wasn't processing things well, or absorbing things and metabolizing them to the benefit of optimizing all my different systems. I had the elevated ALT, which was poor liver function. And if your liver is clogged, it's like a plumbing system. Nothing else is going to work properly if your liver is not functioning optimally. And also I had low good fats, which my brain was not, which is what fuels your brain. My brain was not functioning well, and poor methylation, which means that you're not really absorbing the foods and turning them into energy. And so there were multiple things that had to be addressed.
Thank you. Thank you so much, Christine. This is really a great story. I think it's not only inspiring, but I think there are a few themes that I think that we can take away from this story. The first theme I think that Christine mentioned was that, you know, she was not diagnosed. I think she self-diagnosed it, to be honest with you. Nobody actually diagnosed it for her. And this is actually a pretty routine story, which is sad, but it's true, because what happens is that, you know, a lot of the people, when you go to physicians, you know, they do testing, and when everything comes back negative, then they start thinking that the patient is a hypochondriac. And that's not really the case. You know, the patient is genuinely having issues. It's just that the testing that we do in the conventional realm do not necessarily reflect what's going on inside the body. So that, I think, is a very sad part. The second part, which Christine alluded to briefly, was that, you know, a lot of people who have chronic fatigue also have neurological issues. They may have anxiety, they may have depression. And so when you tell a physician, a conventional physician, that you have anxiety and depression, and the physician says, oh, this is probably why you have fatigue, because you're probably depressed. And the patient is saying, no, I am actually depressed because I'm fatigued. And the physician is saying, no, because you are depressed, you are fatigued. And the truth is that neither of them are correct, because there is the chronic fatigue and depression that's happening at the same time. So really, nobody is correct, but actually both of them are correct partially. So remember that it is very important that you be an advocate for yourself, because the conventional system is not necessarily the best system for chronic fatigue. The third thing that Christine mentioned in her story, which I think is really very clear, she mentioned a lot of things that she found were not helping. And this, I think, is very important, that, you know, it's not what we usually are made to think. Like, you know, how we have one disease and one pill model, and we think one pill can cure one disease. This model is not going to work in chronic fatigue, because it is an onion, which means that there are multiple systems that have broken. Because remember what Christine said. She said that this started 15 years ago, 16 years ago. So what happens is you start with one thing breaking down, and then the second thing breaks down, the third thing breaks down, fourth thing breaks down. Ultimately, you're at a point where you cannot deal with it anymore. That's when you are like desperate. So at that point in time, you have a full-blown, complete system breakdown, with multiple systems kind of not working. So in most cases, chronic fatigue is an onion. And last but not least, I think the most important part that I took from her story is that it was a journey. It was not something that, oh my God, here you go. I took a pill, suddenly I was given a pill and everything got better, and I just went about doing what I wanted to do. So it's very important to understand that it is a journey where you have to slow. It's a process. Of course, if it took you 15 years to break a system down, it cannot be 2 days that anybody can fix the system. And if anybody claims that they can fix the system in 2 days, then you really have to doubt as to what they're doing. Because how is it possible that you break the house down in 15 years and suddenly in 1 day the house is back up? It's just not possible. So it is a journey, but it is a journey where you can be successful. And I think one of the reasons why she was successful is because she was persistent. Despite everybody saying, oh, this is not, you don't have fatigue and you don't have fibromyalgia, she said she was persistent. She was like, no, I know my body. I know there's something wrong. And she persisted. And the truth is, she's still persistent. You know, if something happens, you know that Christine will be the first one to send an email and try to connect the dots. Because remember that, you know, as a functional physician, we try to look at the whole picture. But in this process, the patient is a partner. The patient is not just like somebody who's going to do what you tell them to do. The patient is your eyes, your ears. And when the patient says something, you know, you have to listen and you have to pay attention, because sometimes there is really important points which you may, when your attention may not have gone to, but the patient is like, but Dr. Ali, could this be connected to that? And you're like, that's an interesting question. Is it possible? Let's see, let's look into this. And so it's a journey where you have to take responsibility. You cannot expect that everything will be given to you. You also have a role to play. And so I think those are the things that I think are key things that I would take from Christine's story. Yes.
How do we define chronic fatigue?
All right, so we're going to start off with the definition of chronic fatigue. If you look at the conventional definition of chronic fatigue, and I think this is the part, I think there is one more slide it looks like that you have, Christine, that you have not, I think, covered. But if you want to go over some of the things that you did for your chronic fatigue, and then I can go ahead and define chronic fatigue.
Well, one of the things that I focused on was eating whole foods. Dr. Ali told me everything you put in your mouth, affects your whole body. So that was something that was very important. Eliminating gluten, eliminating dairy, just to really try to reset my system to be healthier. And also the glutathione infusions to support the liver and detox made a huge difference. After several infusions, I was able to feel like a light switch went off and really helped me have clarity and focus in terms of how I was feeling and able to approach things. And we also knew that I had an active Epstein-Barr virus, which affects your whole immune system and can make you feel really run down. And so building up the immune system is very important. Really addressing the gut. The gut really, as we've learned over the last few years, it's come out that it's the most important system in terms of connecting everything and fueling the brain and the other systems. Using sun lamp therapy, especially in the winter when it's very gray, makes a difference for me in my vitamin D absorption. Going to the thermal cocoon at Dr. Ali's office to help sweat out the toxins, and using infrared light therapy, which gets the it hits the cells deeper in your system to help them cleanse and release and rejuvenate. And then also giving blood to get the high ferritin out of my system on a regular basis every 60 days, because hemochromatosis can be very severe and significant in terms of hardening the organs and even contributing to death and affecting all of your systems. So those are things that I've been doing over the last few years, actually, to help feel healthier and get well.
Awesome. Thank you. Thank you so much, Christine. And so I'm going to start off with the definition of chronic fatigue. So chronic means long-term. So anything that goes over 6 months is actually considered chronic. And chronic fatigue means that you are having fatigue or tiredness or exhaustion for over 6 months. And that tiredness is not resolved with sleep or naps or rest. So you actually have a lot of tiredness, and then when you exert yourself, that tiredness actually gets worse. Chronic fatigue is actually a multi-system issue, meaning that there are many organs involved, and there are many symptoms involved that you are going to be dealing with in addition to the fatigue.
Okay, so what symptoms are associated with chronic fatigue?
So as I think, Christine, your story was very clear when you said that 8 out of 9 things were positive, right? So if we look at the different systems that are involved, the first and foremost system that's most often involved is the neurological system, where there's issues with memory, concentration, brain fog, sleep, headaches, dizziness. The second system, which is often involved, is immunological. So these patients would always say, yeah, I sometimes have fever. It comes and it goes. I have sore throat at times. I have lymph nodes which are enlarged, but then they would go away. So it's very interesting that we find that these patients often have infections, underlying infections, which would get reactivated, like mono, herpes. They will also have high antibodies for mycoplasma. They will have a history of Lyme disease, which never resolved even after antibiotics. They would have history of having mold, exposure. They may have history of having, sorry, I'm just going to go back here. They may have history of fungal infections like Candida. They may have history of being exposed to toxins. So The interesting thing that we have found in these patients is that these patients have low functioning natural killer cells, which are actually immune cells. So clearly, if you have an immune system which is not working, not only will you see a lot of bacteria and fungal infections that are getting on board, you will find that the ability of that person to get rid of these infections is going to be limited. The ability to detox is going to be limited. So that's the second system which we find is affected. The third system is the musculoskeletal system, and we find that fibromyalgia is something that we definitely see in these patients. The next system that we see here is hormonal involvement, and we see the two hormones that I think were alluded to by Christine were cortisol and thyroid, which are primary hormones. We definitely see abnormalities in that. But we also see that these women who have chronic fatigue have early menopause because of hormonal imbalances. They also have higher number of GYN procedures, which means they have more hysterectomies than normal women. They have more oophorectomies, which is removal of ovaries. They also have insulin resistance or metabolic syndrome, as we call it, meaning they have issues with blood sugar regulation. The last but most important system involved is the gut. And Christine alluded to IBS. But a very important finding of research is that patients who have chronic fatigue have a very different type of gut bacteria than normal people. So it's very clearly an association between chronic fatigue and the gut. So you can have symptoms like loose stools or pain. But one of the things which is very important that I have seen in a lot of these patients is leaky gut, which, as we all know, is the root cause of almost all diseases, all chronic diseases. Almost all chronic diseases will have an association with leaky gut. And that is why when Christine said that, Dr. Ali said that, what you put in your mouth is important, is because what you put in your mouth is what is going to affect the leakage. That is going to be one of the factors that's going to affect the leakage. And that is why it's so important to have a customized meal plan. So remember that Christine didn't say, oh, go to an AIP diet or go to a keto or do a paleo. The reason why she didn't say that is because she got a diet that works for her. You might have another person with chronic fatigue and they would have a completely different diet which would work for them. So that is why gut involvement is so important.
So how would you say that the conventional medicine approaches or addresses chronic fatigue?
So one of the issues with conventional medicine is that in conventional medicine, first of all, chronic fatigue is a diagnosis of exclusion, which means that all other diagnoses have to be taken care of or they have to be excluded. If they can't find anything else, then they will say, okay, now you have chronic fatigue. The second issue with conventional medicine is that conventional medicine puts all of the chronic fatigue as one category. It's not one category. The reason why it's not one category is because everybody with chronic fatigue has a different set of issues, a different set of exposures, different set of reasons why they have this. So you cannot lump everybody in the same basket. The third thing is in conventional medicine, there is no treatment or cure for chronic fatigue. However, they can help you with certain symptoms, like they can give you a pill for maybe sleep, a pill for a pain, something for depression, but they do not have a pill for fatigue. So clearly the conventional approach is not an approach that is going to be very helpful for somebody who has chronic fatigue.
So how would we crack the fatigue code using the functional approach?
So in the functional approach, the first thing that we do is to identify what organs are involved, right? The second thing we do is that we say, okay, so let's look at the symptoms. Let's see, which symptoms are connected to which organ and how are all of these organs working together. Once you know that, then you have to ask the question, so right now, what are the factors which are contributing to the imbalance of these systems and organs? Are there lifestyle factors? Are there emotional factors? Are there environmental factors? So you have to be able to address all of the things that are affecting these factors, which would actually help you understand the root causes. And then you have to go back because there'll be things which are happening now There are things which happened 5 years ago, things that happened 7 years ago, 10 years ago. So you really have to account for everything. So really the body asks you for accountability of everything that's gone wrong. And then you have to go ahead and undo that in order to be able to overcome chronic fatigue. So in simple words, chronic fatigue is simply a patient telling you, I do not have energy to do what I need to do. So there are only two ways that can happen, right? If I tell you I don't have any money, there are only two things. Either I'm not able to make money or I'm spending more than I'm making. That's exactly what happens in the body. Either you are not making any energy. And remember that what makes energy in the body is a little tiny structure called mitochondria. So either the mitochondria is not doing the job of producing energy, or you're spending too much energy. So imagine that we need energy for our regular activities. So imagine you have a budget of 500 and your bills and everything gets paid with that $500. So that's, you are taking care of things. Imagine you have 500 extra that you have spent that month. What have you done? Now you will not be able to meet your bills on time because the expenditure is much higher. So if you have, in addition to your regular expenses, some degree of inflammation, now your expenses of energy is going to go up. And both of those things can cause an energy deficit. Unfortunately, in most cases, those two processes are connected with each other. So in most cases, the unfortunate patient is in a vicious circle where he or she is not producing any energy and is also requiring a lot of energy.
So can you also tell us about the energy production and how it relates to the mitochondria?
So this is the mitochondria. So this mitochondria, you can see the structure, it has two layers. The most interesting part about mitochondria is that the mitochondria has a DNA. When something has a DNA, it means that it can multiply, okay? So the mitochondria can actually multiply. Now, remember that just like we have dollar as the currency in the United States, if you go to UK, you're not going to be able to use the dollar. You'll have to have pound, right? The currency of the body is ATP. That's the name of the currency of the body. And mitochondria produce this currency. So this is your bank, okay? The second thing that the mitochondria are responsible for is cell death. And this is very important. So when the cell becomes old or weak or is not functioning well, then the mitochondria will send a signal and will cause death of the cell. Imagine if the mitochondria cannot cause death of a dysfunctional cell, and that cell continues to grow and continues to multiply. That's exactly the case that happens in cancer, that you are not able to cause cell death. The process of cell death is directly affected by mitochondrial dysfunction. So cancer can be an outcome of mitochondrial dysfunction. The third and very important function of the mitochondria is storage of calcium, and that is very important. It is important because you need that calcium to release hormones. That's why, if you remember, I said one of the very important system affected is hormonal system. That is because mitochondria are needed for release of hormones. And I said the first important system I said is neurological, because the nerve cells in the brain, the way they talk to each other is through messengers called neurotransmitters. And the brain and the nerves cannot connect or talk to each other without those chemical messengers. And you need calcium for release of those chemical messengers. And last but not least, we need mitochondria for producing heat. So when a lot of women come and they say, oh my God, I cannot stand the cold. And then the first thing people think is thyroid, and thyroid is completely normal. So if thyroid is normal, why is this person still feeling cold? If you have mitochondrial dysfunction, you will have what is called cold intolerance. So the other thing about mitochondria is, and this is the weak point of the mitochondria, let's put it, that the mitochondrial DNA is highly susceptible to damage. The reason is because of the nature of the job. Okay, so for example, what really happens is when the mitochondria is producing that currency ATP, it releases certain toxic chemicals as a byproduct. Okay. Now you can consider the toxic chemical as fire, but we have firefighters, and they most of the time are able to take care of the fire. But in a situation where there's so much fire that the firefighters are now helpless because they really cannot control the fire, that is called oxidative stress. And that is a very important concept because mitochondria are extremely sensitive to that fire. So they're very sensitive to oxidative stress. And when that happens, they cannot function.
What causes the mitochondria to dysfunction?
So there are many different reasons why the mitochondria are going to have a dysfunction issue. The first and foremost you can see here is the Lyme bacteria and viruses. So Lyme disease, bacteria, viruses, mold, they directly attack the mitochondria. Okay, so that is one reason why we often find these patients have a lot of infections, underlying infections. The second very important variable is the toxins, and Christine alluded to mercury. Mercury, arsenic, these are very, very, very reactive metals, and they directly attack the mitochondria. Now, medications actually can also cause mitochondrial dysfunction, and there are a lot of different medications which are very commonly used that can cause that. For example, antibiotics can cause mitochondrial dysfunction. Antidepressants can cause mitochondrial dysfunction. Anxiety medications can cause mitochondrial dysfunction. Statins can cause, which are used for treating high cholesterol, can cause mitochondrial dysfunction. In addition to that, the mitochondria and the gut, they actually talk to each other. And so this is very important because if you have friendly bacteria, the communication is very friendly and very supportive. But if you have crazy bacteria and there is howling and yelling going on, then it's a very bad relationship. And that can affect the mitochondria very poorly. There are other variables that also affect mitochondria. One of them is high blood sugar. If there is high blood sugar inside the cell, that affects the function of the mitochondria. Oxidative stress, and we have talked about this before, that oxidative stress significantly affects the mitochondria. Inflammation. Inflammation definitely causes dysfunction of mitochondria. Rather, now we know that patients with chronic fatigue produce certain chemicals called cytokines. These are inflammatory chemicals which damage mitochondria. And last and very importantly, mitochondria requires a lot of nutrients: iron, zinc, CoQ10, carnitine, vitamin C, vitamin Bs. So if you don't give the mitochondria what it needs to function, you cannot expect it to function well. So those are all the things which can cause mitochondrial dysfunction.
So we know that the mitochondria are sensitive to damage, but what causes the damage?
So before we talk about what causes, we just talked about what causes the damage to the mitochondria, right? So the next thing we want to talk about is what are the systems that are affected by mitochondrial dysfunction, okay? So the first system is muscles. So you'll see weakness, you'll see pain, you'll see a problem with the eye movement because the eye muscles require a lot of mitochondria. The second thing, like I said, neurological system is extremely sensitive. So you will have issues in terms of Alzheimer's disease, Parkinson's disease, seizures, migraines, ALS, autism. We talk about autism being on rise. So one of the questions we should ask is, if mitochondria are involved in autism, then what is it that's happening to that child that you are seeing mitochondrial damage? You see mitochondrial dysfunction in bipolar disorder, anxiety, schizophrenia, and learning disabilities. you see neuropathies in these patients. And one of the things that Christine mentioned was constipation. So remember that the gut motility or gut movement is affected when you affect mitochondria. So these patients may have constipation, they may have reflux, they may have diarrhea. These patients also have issue with fainting, excessive sweating, and temperature regulation issues. Remember that kidneys are specialized organs, which require mitochondria for it to be able to detoxify and filter the blood. If you don't have mitochondria, you will find these patients actually leaking protein into the urine. Heart. Heart is a very specialized organ and it has a ton of mitochondria in it. So in the body, it's very interesting. Every cell has certain number of mitochondria, and that number of mitochondria is dependent on how sophisticated the cell is. The less sophisticated the cell, the less mitochondria. The more sophisticated, the more mitochondria, because you need to have more functions performed. So heart is one of the most specialized organ, and so these patients often have heart failure. They have blockages of blood vessels. They have in terms of liver, non-alcoholic fatty liver disease, low blood sugar, because remember that liver is responsible for supplying blood sugar when you're not eating. So a lot of these people would tell you that they cannot fast because they immediately drop their blood sugar. And that's a mitochondrial dysfunction. The eyes are actually simply a connection with the brain, direct connection with the brain. And so it's neurological in nature. So you'll find patients having blurry vision, visual dysfunction. Ears, again, an extension of the brain, hearing loss, sensitivity to loud sounds. Pancreas. Pancreas has a very specialized function. It releases insulin. So if you have mitochondrial dysfunction, you can actually have diabetes from that because it's not functioning. But pancreas has one other function. You require the enzymes from pancreas to digest and absorb your food. So you will also have malabsorption issues because of mitochondrial dysfunction. And so overall, you'll find these patients having fatigue. They will either have excess weight or they will have difficulty gaining weight. And that's why I say that everybody is different. One other complaint that we see in these patients is they have air hunger. So they will actually say that they have shortness of breath. And the doctor will get alarmed that they have a heart problem, but all the heart tests will be negative. The problem is they have an inability to take a deep breath. They have this feeling of air hunger. That's another classic sign of mitochondrial dysfunction. And we've already talked about exercise intolerance and fibromyalgia. So those are all the symptoms that will be experienced when one has mitochondrial dysfunction.
So you said that the dysfunction of the mitochondria produces a reduction of energy production, but what about energy expenditure?
Well, that's a good question. So that's the second part of the equation. So remember I said that we require energy to do all the processes that we do, whether it be eliminating, detoxing, metabolizing the food that we take. But one of the issues that can really increase our expenditure is inflammation. Now, before, when we did not have such an issue with the environment, people would get an infection, they would get inflamed, and then the infection would go away and they would not have any inflammation. But now we live in this era where we are constantly being exposed to toxins. And whether the toxin is from the silver filling that you have in your mouth, or because like we now know that rice has arsenic, chicken has arsenic, we have pesticides, we have fertilizers. So we are constantly being exposed to material toxins which are causing inflammation. This is not a high inflammation. This is a low inflammation, but it's happening constantly. Also, we live in very stressed environments. I think I've yet to see somebody who is not stressed out, and especially with the COVID-19. I don't have to tell you, we all know what we are going through. So we are constantly in a state of low inflammation. When you have low inflammation, you automatically increase the amount of energy that you're going to need. Now, what happens is, so imagine this. So let's suppose you want more money and you are running out of your budget. So what are you going to do? At that point in time, you'll have to come up with an alternate way to get money. So there's another way that the body can produce energy. Usual way of producing energy is by using oxygen. Okay, that's why we breathe and we take the oxygen in. The second way that we use to produce energy does not require oxygen, but that way is less efficient, which means that you use a lot of fuel and you produce hardly any ATPs. When you do that, you are definitely going to get into nutritional deficiencies. So that's number one. And we now know nutritional deficiencies cause mitochondrial dysfunction. The second thing that happens is when your energy requirement is going to go up and you're going to use multiple ways to produce energy, you will produce a lot of oxidative stress, and that is going to affect mitochondrial function. The third thing that happens with chronic inflammation, and this is a very obvious sign which we miss all the time, and that is chronic inflammation causes lack of sleep. It's a very important sign. A lot of times, if you look at histories of people, they will tell you, well, I was okay, I always had some sleep issues, but everything else was okay. Well, it is not just sleep issue. It is a sign that there's inflammation going on. And when you have sleep issues, then that is going to cause insulin resistance. It is going to cause blood sugar regulation issues, and that will affect mitochondrial function. So if you see here that both production, if you have production of energy is affected by mitochondrial dysfunction, and low-grade inflammation not only causes energy expenditure, it also causes mitochondrial dysfunction. So both the pathways of production of energy and expenditure are going in the wrong direction. No wonder this person is in a vicious circle that they cannot get out of. And that is precisely why chronic fatigue is a diagnosis which requires a lot of work, because you really have to work to get the patient out of the vicious circle that they have put themselves in.
What about hormones? How do they affect the mitochondria?
So, Christy, you remember that you had mentioned two hormones, cortisol and thyroid, and those are what we call primary hormones. So when we talk about thyroid hormones in conventional medicine, there's only one hormone that people talk about, that's the T4, right? Which is a synthroid, the synthetic form of T4. T4 actually affects mitochondria right away. Like if you put in T4 in somebody within minutes or hours, you will see that the mitochondrial activity will go up. But there is another hormone, thyroid hormone, which is T3. Now, T3 actually is extremely important because T3 may take longer to act, but it is T3 which causes multiplication of mitochondria. And you want your mitochondria to multiply, especially if the cell needs more mitochondria for the production of energy, and you cannot multiply mitochondria. You can only increase the activity of a single mitochondria to a certain degree, but not more than that. But if you produce more mitochondria, you can double, triple, and even quadruple your production of energy. So if you don't have T3, then you will be limited in terms of how much energy you can produce. That's number one. Number two, cortisol. So cortisol is a hormone of inflammation. And you can see here how cortisol directly impacts mitochondria in three ways. The first one is increase in blood sugar. We know that high blood sugar negatively affects mitochondria. Second, cortisol is a hormone that causes more inflammation. And we know inflammation causes mitochondrial dysfunction. And last but not least, cortisol has a direct impact on the thyroid function. So it prevents the thyroid gland from functioning. So you can see that there are multiple ways in which cortisol actually affects mitochondria. There are some other hormones which we call secondary hormones that also impact mitochondria. Estrogen actually affects both the structure and function of mitochondria. Progesterone and testosterone actually protect mitochondria. And then DHEA also improves the function of mitochondria. So those are the other hormones which also impact mitochondria.
So how do we fix the energy deficit?
All right. So what I'm going to give you is basic principles here. Now, remember that you don't have to go through the sequence. The sequence will be determined by the individual patient. You may not even have to do all the steps in everybody. But basically what you want to do is you want to first identify and reverse inflammation. You definitely want to correct metabolic imbalances, whether it be high blood sugar or high ammonia or high urea. You want to work on your nutrients because your nutrients are the key. Very importantly, like I said, if there is fire, then you have to have firefighters to be able to put out fire, because if the fire is going to continue, you're not going to be able to save anything. So that's reduction of your oxidative stress. Very importantly, microbiome. Remember, we said that these are the gut bacteria. They can play a very important role. Fix the microbiome. And last but not least, balance the hormones. A word of caution for balancing of hormones. I have seen a lot of people who actually came to me after somebody tried them on a particular hormone. And the reason for that is you have to understand that your hormones is like a web. It is not a single strand that you can pull. When you pull one strand, 5 other strands are going to be affected. So make sure that don't just look at a lab and say, oh, it's low, let's start you on that. That's not the way to do it. You will crash that person. You have to understand what is the connection between all the different hormones and make sure that you pull the strings only if you need to. The first thing should be to allow the body to make its own hormones. Do not use hormones as a band-aid, because you can have a lot of adverse outcome if you just try to band-aid the situation.
You mentioned that nutrients are a tool to help mitochondria. What is the role of high-dose intravenous vitamin C on chronic fatigue?
So Christine had mentioned like how she got, she got 2 things. She got high dose IV vitamin C and she got an antioxidant. And remember, the antioxidant is the firefighter. And we have talked about firefighters a lot today. So if we look at just the one aspect of it, and I'm going to leave the firefighters out of the picture because we have talked about it quite a bit. So if we just look at vitamin C, here's a study which was done from May to June 2007. They took 7 patients. These are the patients where they have tried all conventional therapy, like the depression medications, the pain medications, and nothing's helping them. That's why they're called resistant fibromyalgia. And they gave them intravenous therapy, nutritional therapy with high dose C, and they found that there was 60% reduction in pain and 80% reduction in fatigue. And this is without doing anything. But this is very important to understand that they did not change their diet. They have no idea what the hell is going on inside. They just said, you know what, just get some C, put it in them and see what happens. So IV nutrients are very powerful. No question about it. But you also have to remember that you need to know how to use it, because you cannot give somebody IVs for the rest of their life. That is crazy. So it's used as a tool. So you need to know how to use the tool. It is very powerful, but you need to know how to use it, when to use it, okay? There's another study which was done with high-dose IV vitamins. It is a study from 2012. They took 141 workers between the ages of 20 and 49, and they found there was a reduction in fatigue within 2 hours, reduction in oxidative stress. And so it is a very powerful tool. But it has to be customized, meaning that it's not like everybody gets the same dose. Everybody needs a different dose. And sometimes we have to figure out, like, I think one of the things Christine said in her story was that she got maybe 4, 5, 6 IUs. Suddenly the switch went on. Oh my God, I'm feeling so much better. So what was happening? Why did that not happen in the first IV? The reason is because we were changing the dose. We were making certain adjustment here and there because we wanted to know exactly what combination would work for Christine, because we also don't have a magic wand that we can like, oh, here you go and you're well. So that is the key. You can do what you need to do, but you need to know how to do it. So yes, it's a very powerful tool.
So what other functional tools do you use to help patients extinguish the energy deficit?
So we have a lot of functional tools that we use. Very importantly, there's some that, Christine mentioned that I thought was actually, I think she mentioned literally almost all of the tools. So if we look at here, she mentioned lifestyle. We talked about customized meal plans. Functional testing is what she mentioned. I think that's critical. It's critical to know what's going on. When a patient comes to us, we don't just put them on a supplement or some kind of an IV because we have no idea what this person needs. And how would we know if we don't have testing? So testing is the key. The hormones that we use, like I said, is not the first thing that we use. We try our best to have the body make its own hormones. And if we have to use hormones, we always use bioidentical hormones. Mind-body techniques are key. If we cannot alleviate stress, if we cannot address the trauma, we are not going to be able to address fatigue. She mentioned the hypothermic infrared therapy. We use that. We use detoxification therapies. We use fasting. And remember, fasting can actually cause harm and fasting can be helpful. So you need to know why you're doing what you're doing and at what stage you're doing that. That's very important. So those are all the tools that we use in functional medicine.
Great. So I think we were going to share the topic for the next webinar, which is reversing Alzheimer's and memory loss using the ReCODE protocol. And that's going to be on Saturday, January 9th at 4 p.m. You can register there. And Dr. Ali was going to mention some studies that are done around the ReCODE protocol.
So some of you may know Dale Bradison. Dale Bradison is a functional neurologist researcher who actually is presenting his data. He actually was able to use the ReCODE protocol to reverse over 90% of cases of early loss of memory as well as Alzheimer's. Interestingly, his book has been a bestseller for a long period of time, but this is actually a protocol that functional physicians have been doing for a long time. It's the first time somebody has gone ahead and published it. So I think that I want to go over that protocol to kind of talk about how when we have a neurological disease, early dementia, Alzheimer's, Parkinson's disease, what are the principles that we use to kind of reverse those diseases using the ReCODE protocol.
Okay, if you have questions, you can type them in the Q&A box at the bottom of your screen. If you have other questions outside of today's topic or referencing the January topic, we'd love to hear your challenges pertaining to memory loss or loss of concentration, brain fog, or Alzheimer's, so that we can help to address some of those questions at the January webinar. And that concludes today's topic, and we'd love to hear any questions or concerns that relate to chronic fatigue if you would like to share those. The one question that we had was giving examples of functional testing that you use. So we did give some examples. I don't know if you'd like to elaborate on that, Dr. Ali, in terms of the different tests that you use in functional medicine.
Sure. So basically, the type of testing that we do is dependent on your history, right? So if your history is telling us about gut issues, the testing will be pertinent to that. If your history is telling us about hormonal issues, then our testing will have to be directed at that. So it's not like everybody will get the same test. Everybody will get different tests depending on what we think is the underlying problem. So that basically is how we determine what kind of functional testing we are going to use. We also use conventional testing actually at times whenever we can, because there are certain tests which are actually underutilized even in the conventional setting, like the thyroid panel. There's a complete thyroid panel that you can get through conventional testing. You don't have to do functional testing for that. So we utilize conventional testing as well, but conventional testing is limited. There are only certain things that you can go through and do from the conventional standpoint. So we use both testing to the best of our ability, depending on what the issues are.
Another question was regarding a little more specific information around IV therapy. I don't know, maybe talking about the benefits of glutathione, I think that that's something that you generally include in most people's IVs because of the benefits of glutathione.
So we use a number of antioxidants. We use glutathione as one of the antioxidants. We use alpha lipoic acid as another antioxidant. Well, as far as the use of IV therapy is concerned, remember that intravenous vitamin C actually has many functions. It has function as antioxidant. It has function as immune modulator. It has function as adrenal modulator. So when we are looking at IVs, like a lot of times people think it's about getting some nutrients. I mean, if you need some nutrients, you can also take a pill. It's not a big deal. We are not using nutrients to replete your body. It's not just for that purpose. We are using nutrients as a healing modality. The nutrients also have a therapeutic benefit. Okay, and we are using that as a therapeutic benefit. And when we say, okay, this person needs IV, we are very clear as to at what point in time we want that person to use that. We are also very clear about what other nutrients we want to add, and we are very clear about how we're going to dose that and whether we will do glutathione or ALA. And a lot of that information comes from nutritional evaluations that we do, which gives us some idea about, where is the imbalance heading towards. And depending on that, we do that. And then, like I said before, the patient is our partner. So we will often tell the patient, look, we are going to be increasing your dose. And when you find that switch has turned on, just let us know, because we're not going to increase the dose anymore, because you will be the one telling us this is what works for you. So at that point in time, we kind of hold, because it's not about giving somebody like 500 grams of C. No, you just have to give enough to turn the switch on, and that's it. And then you maintain that for some time, and then you start reducing it, because the goal is that you allow the body to sustain the result. So that is how. We also have some other IVs, which are not high-dose IV vitamin C, but they are used in neurological protocols, which is what we call high-dose IV phosphatidylcholine. So we use that as well. So we have a number of modalities, and we use that depending on what type of patient it is, what is the system, what is the problem, and where the problem is. So that is how we use intravenous therapy. We do have some practitioners who send us their patients. So we have some coaches and we have some naturopaths. So they are taking care of their patients, but they come to a point and they're like, you know what? This is what we could achieve, and now we can't. We need IV, because naturopaths have used IVs. They're trained in using IVs, but they don't do that here. So we get a lot of these patients from other practitioners, and they continue to see their patients, and we just provide IV support to those patients, because we know that the practitioner knows what he or she is doing. So they just need support in one area, and we do provide that support.
Another question was specifically around the SpectraCell lab. Does it measure vitamin K levels?
SpectraCell measures vitamin K2, not K1. It does measure K2.
Okay. And someone else asked if the tests and blood tests are covered under insurance.
So it depends. So there are certain tests which can be covered by Medicare. Most insurances do not. So for example, the leaky gut test, nobody covers that test. Why? Because according to insurance, it is research. Don't ask me why. I'm not making the rules. But again, there are tests which they would cover, there are tests which they would not cover. We'll let you know whether this will be covered. Medicare is the best insurance. If you have the regular Medicare, a lot of tests like adrenal test gets covered by Medicare, blood test gets covered by Medicare. So if you have the normal Medicare, then they are very helpful for certain tests. And we'll tell you beforehand, well, this can get covered, so you don't have to worry about that. But there are certain tests which, the insurances don't cover, and that's when we get stuck.
Okay, I think that was the end of the questions. We had some good questions. Appreciate everyone's input. And if you have additional questions, you can send them to the email section that we listed. And we appreciate everyone's participation today.
Thank you. And thank you, Christine, for moderating. Really appreciate your help. And thank you, everybody, for joining us.
Thank you.
Bye.